So, jetzt freue ich mich besonders auf Dr. Nicola Lindson aus Oxford zu uns gekommen. Wir wollten zuerst das online machen, jetzt hat sie es doch geschafft, persönlich herzukommen, und das ehrt uns ungemein. Sie ist Associate Professor in the Center of Evidence-Based Medicine at the University of Oxford. She's been involved in tobacco smoking research since 2008. Her work has mainly focused on ways to help people to stop smoking. And she is a core member of the Cochrane Tobacco Addiction Group, leading their living systematic review of electronic cigarettes for smoking cessation, which has informed international policy and guidelines. Also das ist eine lebende, fortwährend, kontinuierlich arbeitende Gruppe, wo die neuesten Ergebnisse zu Rauchentwöhnung ständig ergänzt, erneuert werden, vorgestellt werden. Und Nicola Lindson beschäftigt sich, wie gesagt, ganz stark in dieser Gruppe damit. Und wir werden heute die Ergebnisse der Cochrane Review hören zu E-Zigaretten und etwas darüber hinaus. Bitte, Nicola.
Thank you very much, and thank you very much for having me here. What I'm going to speak to you about today is the role of e-cigarettes for helping people to quit smoking, and in particular I'll be focusing on the Cochrane evidence that I've been involved in putting together. Okay, so first of all, just my disclosures. So this work has all been supported by Cancer Research UK and the NIHR in the UK, and I have no conflicts of interest to declare. I'm obviously extremely grateful for the funding for this work, but also to my co-authors on everything that I'm going to present here, and also the investigators of the studies who have shared all of their data and their work with us to be able to come to these conclusions. So first of all, for those of you who may not be aware of what Cochrane do, Cochrane is a global non-profit organisation, and what it aims to do is basically gather and combine all of the evidence from research in order to determine any benefits and risks of healthcare treatments or interventions. And Cochrane do this by systematically reviewing the available evidence, and they have a very strong emphasis on quality assessment. So basically assessing the quality of all the studies that go into the reviews so we can determine whether we trust those results or not. And Cochrane have basically had a major role in determining the methods of systematic reviews, and all of the methods that Cochrane have developed have been to minimize bias in those methods so that we can have as much trust as possible in the results of the reviews. And for that reason, Cochrane reviews and the methods that are used are typically considered to be gold standard. So the idea is that all this work and these systematic reviews help healthcare providers, patients, carers, and all other stakeholders to improve their knowledge of the healthcare systems and interventions that are out there in order to help them to make decisions. So now going on to the living systematic review. So as Heino said, I'm involved in carrying out some living systematic reviews, and just to give you some background on what a living systematic review is as opposed to a normal systematic review, it's basically a systematic review which is continually updated. So we incorporate all the relevant new evidence as it becomes available. And we do this through active monitoring, through regular searches of the literature, which in our case happens monthly. It depends on the researcher what they decide is needed, but for us, we've decided that we're going to search the literature monthly. And what we do is we then communicate links to the new evidence that we find. So we put it out there, these are the things that have come up this month. Now, we monitor that evidence to see whether we think that new evidence is going to change our conclusions from our reviews, and if we do think that that's the case, then we run a full update of the review. So we're not doing a full update of the review every month, but we are monitoring that evidence to see whether an update is necessary. So it can work out that we do a couple of updates to a review a year. So now to actually dig into the data. So our first living systematic review that we set up was one looking at the role of e-cigarettes for smoking cessation. Now, this review was first conducted in 2016. It became living in 2020, and it's been updated many times since. And the objective of this review is to evaluate both the safety and the effectiveness of using e-cigarettes to help people who smoke achieve long-term smoking abstinence. So this review doesn't tell us anything about people using e-cigarettes who have never smoked. This is specifically for people who are using e-cigarettes to stop smoking. We include randomized controlled trials in this review, so basically studies that have randomized people to either e-cigarettes or a control condition, but we also include uncontrolled intervention studies where people who smoke have all been given the same e-cigarette intervention. These latter studies are not focused on as much in the review, but they are included so that we have the entirety of the relevant evidence there. And we include studies that look at smoking cessation at 6 months or more, because we're interested in long-term outcomes in terms of smoking cessation, but we also look at measures of harm measured at 1 week or longer. So just in the interest of time, I'm going to just present to you what we see as our key findings from this review. We have a number of different comparisons in the review, e-cigarettes versus NRT, but also e-cigarettes versus non-nicotine e-cigarettes and e-cigarettes versus behavioural support only. But obviously, what we see as being the most important is this e-cigarettes versus nicotine replacement therapy comparison. And that's because obviously we know that nicotine replacement therapy is a beneficial treatment for helping people to quit smoking. It's an available treatment. So what we're really interested in here is how do e-cigarettes compare to that available treatment. This outcome is our quitting at 6 months or over outcome. And what you can see from this is that there is evidence, and this evidence is high certainty, that e-cigarettes help more people to quit smoking than nicotine replacement therapy does. And that translates to an additional 4 people in every 100 quitting when they use e-cigarettes as compared with nicotine replacement therapy. And it's worthy of note that none of the studies in this analysis were judged to be at high risk of bias. We also, as I say, look at safety. So 2 of our safety outcomes are non-serious adverse events and serious adverse events, sorry. So this table shows you the results that we have for that. You can see that in both cases, there's no clear evidence that e-cigarettes are causing more adverse events than nicotine replacement therapy. However, with these outcomes, we have a little bit more uncertainty. And that's just because we're not seeing that many serious adverse events or adverse events, but especially serious adverse events in smoking cessation trials. So it's a good thing. It's great that we're not seeing many serious adverse events in smoking trials, but it also means that we're less able to say whether there's a difference between the 2 conditions just because of the imprecision that we're seeing in the results. So we have moderate certainty evidence that there's no clear difference in adverse events and low certainty evidence that there isn't a difference in serious adverse events. And what that means is that as more evidence becomes available, there might be some difference in the interpretation of those effects. Another thing just to mention here is that you can see from the table that for our safety outcomes, the longest follow-up for non-serious adverse events is 9 months, and for serious adverse events is 1 year. So these are quite short-term outcomes, and what we really want to see is longer-term outcomes in terms of safety. One of the things that we looked at to try and delve a bit more into this safety issue was differences in biomarkers. So we look at this as part of our main review, looking at it between randomized groups, but we also published this paper where we looked at biomarkers of potential harm between groups depending on how they changed their behaviour. So in people who switched exclusively to e-cigarette use, people who switched to dual use, so still using combustible cigarettes but also using e-cigarettes, and people who just continued to use combustible cigarettes. And just to give you a kind of summary of the results that we found there. When we looked at carbon monoxide, we found that carbon monoxide was lower in people who switched to e-cigarette use versus those who were using both e-cigarettes and combustible cigarettes. Also, when we compared e-cigarettes to combustible cigarette use only, again, carbon monoxide lower in the e-cigarette group. And carbon monoxide was also lower in people who were dual using, so people using e-cigarettes and combustible cigarettes, versus if they were using combustible cigarettes alone. When we looked at those potential biomarkers of harm, of which there were many, and they're all very difficult to pronounce, so I won't go through them one by one. If we compared e-cigarettes with combustible cigarettes, we found that 12 of 13 of the biomarkers measured were significantly lower in e-cigarette users, with no difference found in the 13th that they measured. When we compared e-cigarettes with dual users, people using e-cigarettes and combustible cigarettes, 12 of the 25 biomarkers were lower in the e-cigarette group, and 5 were lower for people who were dual using, and for the remaining 8, we couldn't draw any clear conclusions. There was only one study comparing dual use with combustible cigarettes only. Of the 13 biomarkers that they measured, 12 were significantly lower in the dual use group, and there was no statistically significant difference detected for the 13th. So the evidence is kind of suggesting to us that if people are switching to e-cigarette use or even to dual use, then the potential biomarkers of harm are reducing when we're comparing that with people who are just using combustible cigarettes. However, based on this that I've shared with you and our living review of e-cigarettes for smoking cessation, there are still some key gaps there. So up until recently, I'm not entirely sure what the situation is here in Germany, but I know there's been difficulties all around the world getting access to varenicline, and cytosine only being available in certain places. We're now seeing in the UK that there is more availability of both varenicline and cytosine, so it's really important to look at the evidence of how e-cigarettes compare to these two drugs. And at the moment, there's only one very small study in our review looking at comparing e-cigarettes to varenicline. There is one coming up in our most recent update as well, another one. But there are no studies at the moment directly comparing e-cigarettes to cytosine. So what we did and was published in 2023 was what we call a network meta-analysis, looking at all the different treatments available around the world for smoking cessation alongside e-cigarettes to try and look at that comparable effectiveness. So we compared e-cigarettes, NRT, varenicline, cytosine, and also bupropion and nortriptyline. And for the purposes of today's presentation, the outcomes of interest here were cessation and serious adverse events. So just to explain what a network meta-analysis is, if you're not familiar, basically in our normal e-cigarettes for smoking cessation review, we're just including what we call direct evidence. So trials directly comparing, for example, e-cigarettes with NRT. In a network meta-analysis, what we can do is also bring indirect evidence into the picture. So we've got studies that directly compared two different treatments. So that could be cytosine versus placebo, and a nicotine e-cigarette versus a non-nicotine e-cigarette. But where we don't have that direct evidence between cytosine and nicotine e-cigarettes, we can get an idea of what the effect estimate might be between those two things by looking at the direct evidence. So this is what we call indirect evidence. So this is what we did, and for our smoking cessation outcome, we found 299 trials that were looking at this with over 145,000 participants. What you can see from this figure here is that, encouragingly, all of our treatments of interest were more effective than no treatment. That's great because these are all being used in practice, so a relief. But what we also found were that cytosine, varenicline, and e-cigarettes all appeared to be the most effective treatments. So I've highlighted the results that that refer to those treatments here. You can see that they're all very similarly placed on the scale. They all have overlapping confidence intervals, suggesting that there could be comparative effectiveness there. They were closely followed by combination NRT, again, as you might expect, so using two forms of nicotine replacement together, such as a patch and nicotine gum. Another thing that's worthy of note, this evidence did all come from NRT studies rather than nicotine e-cigarette studies, but there was some evidence that nicotine-based treatments might be more effective if they're reduced prior to stopping them. So, for example, if someone uses a nicotine patch and they start with 21 milligrams, then reduce to 14 milligrams, then to 7 milligrams, that might help them to stop smoking and then not to relapse. So that might be something to consider in future also for e-cigarette treatment. We also looked at, as I said, at serious adverse events with this network meta-analysis. Here we only found 85 trials looking at serious adverse events with over 56,000 participants. There was low certainty evidence of no clear difference in serious adverse events for nicotine e-cigarettes compared to no pharmacotherapy or placebo. And what we mean by placebo here is a non-nicotine e-cigarette. So again, that's encouraging, but as you can see, there's still some imprecision, so the confidence intervals are still crossing that line of no effect. And ideally, we need more evidence. And it also suggests there's also a lot of overlap between the different interventions. So again, that's suggesting that at the minute there's no clear evidence that there are more SAEs in any of these treatments when compared to one another. So to kind of round up that kind of evidence in favour of e-cigarettes for smoking cessation, there are still some, as I said, some gaps. Ideally, what we need more of are randomised controlled trials comparing nicotine e-cigarettes to other frontline pharmacotherapies, such as varenicline and cytosine. That would strengthen that evidence comparing the two. We'd also like to see more studies of randomised controlled trials investigating e-cigarettes as an adjunct to other quitting aids. So, for example, with that hand-to-mouth action of e-cigarettes, that could be one of the reasons why we're seeing it working, and combining that with a drug that we know is effective, like varenicline or cytosine, might be an interesting way forward. We'd also like to see more studies directly comparing different e-cigarette characteristics, so things like nicotine content, flavour, device types. It would be great to know which ones of those work better in practice. And any RCTs that are carried out, we'd like to follow participants for at least 6 months, because we're obviously interested in that long-term smoking cessation effect. We want to see these studies assessing the safety profile of nicotine e-cigarettes, ideally for as long as possible, so we've got more strong evidence on safety in the long term. We'd like these studies to use the most up-to-date devices. We all know that research can take a long time to do, so if you're already starting out your research with old devices, there is a chance by the time your research comes out that those devices are no longer available. We want the research coming out to be as applicable as possible to a real-life scenario. And moving on from that, it's important that trials provide e-cigarettes in the way they'd be used in the real world. And on top of that, it'd be great if researchers could monitor people's changing preferences for things like flavours and nicotine content, so we can see how people are actually using these devices to quit. So the good news is that there does appear to be a steady stream of new evidence coming out that we're going to be able to include in our review. This is a bit of a messy graph, but it basically helps us to track what we're finding each month in terms of new included studies, papers linked to our included studies in the review, and any ongoing studies that are being started. And we've tried to put kind of lines of best fit through that, so you can see that there appears to be month on month a gradual increase in the number of studies that we're finding, and we have just received funding for another 2 years for our living reviews. So that's great news, because we can continue to incorporate this new evidence and hopefully strengthen our conclusions further. So one of the things in doing this review over the years that we've been asked about a lot by different policymakers in particular, is how many people go on to vape long term after they've used e-cigarettes to quit smoking. And so we carried out, again, this kind of extra paper on the side of our review that includes the studies that are in our review, but we look at the data in a slightly different way. And here we looked at how many people were using e-cigarettes for 6 months follow-up after they'd quit smoking. 54% of all people given an e-cigarette and 70% of those who successfully quit were using their e-cigarettes still at 6 months follow-up. Now, one of the reasons could be that it's this longer-term use that is actually helping e-cigarettes be more successful. We know that with nicotine replacement therapy, people often don't use it optimally, and this could be one of the reasons why it doesn't get as good quit rates. So it's not necessarily a bad thing that people are using these products for a long time, and I think a lot of people have put a lot of effort into trying to get people to use nicotine replacement therapy in the same way. However, it's also something we have to acknowledge that not all people want to use e-cigarettes in the long term or want to imagine that they will be using an e-cigarette for life. And what we're seeing, worryingly, in the UK certainly, and I'm not sure whether it's the same here, but perceptions of e-cigarette harms are increasing. So although the evidence is getting stronger for them as a quitting aid, and they are available as a quitting aid in the UK, this is data from the Smoking Toolkit study, which is carried out at UCL in London. We are seeing that more people think that e-cigarettes are more harmful than smoking, and less people are thinking that they are less harmful. And we are carrying out interviews as part of other studies and hearing that there are real concerns from people about swapping one addiction for another with e-cigarettes. So one of the things we had been thinking about as a group was, well, if we can tell people that there are clear ways that they could quit vaping if they wanted to, evidence-based ways, might that encourage them to think about using e-cigarettes as a quitting aid in the first place? If we've got this worry that people, you know, we know some people are thinking, well, I'm not going to use e-cigarettes because I'm worried about using them for life, how do we reassure them that that might not be the case? So in the UK, our clinical guidance does suggest that people should be told to quit vaping after using a vape to quit smoking. However, at the minute, they're not able to offer any guidance on specifically how we might do that. So we're in this kind of tricky situation. So that encouraged us to set up this New Living review, which we're now running alongside our review of e-cigarettes for smoking cessation. It's called Interventions for Quitting Vaping. Again, it's a Cochrane review. The first version of this was published in January this year, and what we found were 9 included studies, so there's still not a lot of evidence in this area. 5 recruited adults of any age, 3 young adults and 1 adolescent, and the interventions that they looked at were cytosine, varenicline, nicotine replacement therapy, text message-based support, and a behavioural vaping and nicotine reduction intervention. As I say, there's not a great deal of evidence, and because there's so many different interventions there, there's not a lot of studies looking at each intervention, but we did see some promising, albeit low certainty evidence in favour of varenicline for helping people to stop vaping and text message-based interventions. And it's not with the other interventions that we didn't find promising evidence, it's just that at the moment we don't have enough to be able to draw any clear conclusions. But it's important to say that one of the things that we're really keen on monitoring in this review is relapse to smoking or uptake of smoking, because what we're very clear about is that we don't want people to stop vaping and then relapse to smoking or take smoking up. So that is something that we are monitoring in this review. Unfortunately, of those 9 studies that we found, only 1 of them actually looked at this, and that was a short-term 4-month study. So we hope that partly by doing this review and being able to talk about that it will encourage people to monitor this in as an outcome in their own trials, because we don't want to be encouraging people who've quit using a vape to quit that vape if then they're going to return to smoking. But But there were 20 ongoing studies identified in our review, so again, we're really hopeful that there's lots more evidence in the pipeline that's going to be coming out that can help to inform this. And as I say, this is now also a living review with monthly searches, so we'll be able to monitor that evidence as it comes out. And just as a final preliminary observation on this, so one of the things that we've noticed in doing this new review, and with the experience within Cochrane of doing lots of reviews in the past of interventions for smoking cessation, what we have seen is that there appear to be much higher quit rates in this vaping cessation review than we've previously seen in smoking cessation reviews. So, for example, our highest quit rates that we generally see in a Cochrane review are in our review of varenicline for smoking cessation, which finds quit rates in the intervention arms of around 23% on average. Other average quit rates are around 9% for text messaging, 17% for NRT. Our average quit rates for placebo and no treatment arms in smoking cessation reviews is between like 4% and 10%. From the table here, you can see that we've got some really high quit rates. So in one of the text message-based interventions, there's 38% quit rate. The same with the behavioural nicotine tapering intervention. And even you can see there's a 28% control quit rate in one of the studies. So we could interpret this a number of ways. It could be that people are finding it easier to quit nicotine vapes than they are to quit cigarettes. On the other hand, just to add balance, it could be because the population that we're seeing quitting vapes, the people who are quitting now are the people who will find it easiest to quit vapes, and that, you know, as we go down the line, people might find it harder to quit vapes, and that's what we've seen in the smoking cessation literature, and this is why it's getting harder to help people to quit, because those people who find it easiest to quit cigarettes, have already quit. So there's two different ways this could be interpreted, and really it's just something that we need to keep monitoring, because it could be a very encouraging message for people who want to use e-cigarettes to quit smoking if we can say to them, well, yes, use an e-cigarette to quit smoking, then there are evidence-based ways that we can help you to quit that vape in future, and it will likely be easier for you to quit vaping than it will be to quit smoking. So that's the kind of thing that we're hoping to go on to monitor in the future and to be able to say more about. So that's it from me. If you would like to keep up to date with these projects, our webpage is at the QR code here. We, as I say, communicate the results of what we find each month. We do that through briefing documents. So we have one aimed at members of the public and another aimed at clinicians and policymakers, where we try and present things in a way that is fairly understandable. And on there, we update that every month to say what we found in the literature. Me and my colleague, Jamie Hartman-Boyce, also co-host a podcast called Let's Talk E-Cigarettes, which you can find at all good places that you get your podcasts. Again, there, each month we talk about what we found each month, and we usually interview somebody from the research community about work that they're doing in this area. And we do disseminate our findings on social media, so we are on X, but we're also on Blue Sky and exploring other social media opportunities. So if you have any ideas about where we should be presenting our findings, especially if there's anywhere specifically in Europe that you think would be a good place to get this out there, then please do let me know.
Just stay here for a few minutes. Many thanks, Nicola. Now I know what you meant with, let's say, focusing on the Cochrane-based results and a little bit broader. So you gave an outline of what kind of research is needed in future and the topics you're working on at the moment. So we've got, let's say, time for a few questions. It's a little bit tight. Bitte, Herr Heigl-Stefani.
Yes, thank you very much for the interesting talk. I have one question. Did you regard or consider was to cover other alternative products for cigarettes like nicotine pouches, e-cigarettes into study? to look whether they have a similar potential for smoking to support smoking cessation. And second question would be, you have an increasing population of people who are vaping but never smoked before. There should be maybe some sources really to address whether the digital potential of e-cigarettes is lower compared to cigarettes. Is that on your table for investigation?
So we've got a Cochrane review in the pipeline currently on nicotine pouches and them being used to help people to both quit smoking and to quit vaping potentially. We don't have any studies yet of them used to help people quit vaping, but that is, it's literally just been written up and is in my inbox ready to read. So should be coming out soon. In terms of work on looking at e-cigarettes being used in people who don't smoke. In terms of our vaping cessation review, we will also be including those populations. So we include any populations, whether they have smoked tobacco in the past or whether they haven't, to look at helping those people to quit vaping. It's definitely, I think, everywhere a hot topic in terms of what can be done in terms of regulation to discourage people who haven't smoked before from using vapes. So that's not something that we focus on as much in our group. We're more looking at the tools to help people quit smoking and vaping, but very interesting and very important.
Okay. Yeah, thank you very much, Nicola, once again, for these answers.